Okay, we're going to go ahead and get started because actually we have some interesting cases and things to talk to you about preparing for your travel. I'm Karen Sharon from Department of International Health. I know a lot of you are from our department. I think there's some people who have applied to Center for Global Health funds that are from other departments. With us we have Melinda Munoz, who is a doctoral student, Dick Dunning, who you may have sent things to from Center for Global Health, and Luke Mullaney, who is a professor in our Department of International Health, and Christina. If you haven't done so and you're in our department, you need to sign in with Christina because this is a required training for everyone. And many of you are wondering why you're here, and hopefully we'll convince you that we're giving you some resources that you can use for when you go into the field. So really what this is about is thinking about planning your trip, and you probably don't know where you're going yet, which means that you're trying to think about where are the resources and what do I need to think about. There are a lot of different resources that are available to you that we're going to go through, but I kind of wanted to just get a sense of the room. How many of you have traveled to a developing country? Very good. That even though you've traveled somewhere, we have some things you need to prepare and some expectations of you when you're in the field, and that's another reason why we're having you all come together. So, okay, well, let's, so actually I jumped. Really what we're going to be talking about is thinking about your personal responsibility. You may have no questions now, and I guarantee you'll have questions before you travel. And so hopefully you're going to be taking what information we have and being able to see where you have resources, use those resources, and if you get to a stumbling block after those resources, there are people that you can go to. But there really are things that we are putting in place to try to prevent the panic of what actually you're going to do when you go overseas. What do I need to do to prepare? And today we're going to be discussing some cases and then health considerations. So that's how we're going to run the day. So anyway, I'm going to let Dick come up and talk a little bit about what Center for Global Health has to help you plan for your trip.
Okay. So we took a number of the different materials that have been, well, some of them in existence already, and we added some more in the last week, consolidated them on our website. You don't have to memorize the URL. Just go to our website, drill down where it goes to student travel grants, drill down, you'll find it. Not a problem. But we have a number of things in here. I think the one thing that I really...
Do you want to navigate to it?
Okay.
Yeah, I can just open it up. Okay.
So that's where a lot of the stuff that we're going to be talking about today is on that website. We'll try to add things as we go along, like the agenda for today, and there'll be a link. This is going to be recorded, so we'll have a link to that, or we'll figure out some way of doing it so that it's not generally navigable, because we don't want to have it so that everybody in the world can navigate to it. So the handbook is something I would call your attention to because we spend a lot of time working on that. For a lot of you, I've had feedback from students, and they said, well, you know, a lot of this stuff I know already. Well, that's fine, but at least it puts it all in one place. So the one thing that I really want to talk about very strongly is ISOS. Do we have that slide for ISOS? How many of you know about ISOS, International SOS? Wow. Okay. The university has spent a lot of money having a contract with International SOS, ISOS for short. ISOS is there to help you overseas if you get into trouble. And that means if you get into trouble with the law, if you get in trouble in that you're sick, if there's some sort of civil unrest and you have to be evacuated, or natural disaster you have to be evacuated, ISOS will help you with that. The one thing that people don't realize, they know about the evacuation part, but there's another piece to this. If you get sick and your treatment needs money up front, ISOS will get that money for you. Not that it's free. They'll come back, they're going to build a university for it, and the university is going to come and say you're not going to get a degree until you get this money back. But in short, you don't have to worry about transferring money in your own accounts and so forth. So don't forget ISOS, very important. And my suggestion to you is go to the website that we just showed, go to the link that has the card. You can print that card, carry it with you, take the number that's on there, because there's a number unique to Hopkins, go to the website and log in with that number, and you have all the resources are there. You can also sign up for a number of feeds by email about what's going on everywhere. They're a pain, but they're only electrons. I delete them every day, unless I'm interested in something. So think about doing that. When I'm talking about ISOS, we'll also talk about the registry. The university, for those of you in public health, you may know that there's a registry at the School of Public Health. The university has decided that there's going to be one for the whole university, which will take the place of the one for public health. It's coming soon, but we don't know exactly when, so I'm really reluctant to say go this specific place, but it may be that before you travel this year, we will point you to that and require you to register. And because I don't know about how International Health is going to do it, but if you're traveling on our dime, I will have access to who's registered, and I will be able to compare who we funded with who's registered. And we're really going to be making a pain in the neck of ourselves to do that. So, next thing.
And I think the registry issue, you may do 2 projects, so you may not go overseas for the first project. If you leave the country as a student, we need you to be able to provide information on where you're going. So whether it's the registry, whether it's forms through, if you're funded through Center for Global Health and it's forms for them, and whether you're in the Department of International Health and we have things you need to complete. There's been some misunderstanding about whether it's your first project, your second project, when you're going. If you're still a registered student, we need to know. I think it's pretty obvious why we need to know. If there is an earthquake, we need to know where you are. And there are things that happen across the globe, and we don't want to have to go scrambling to find you. We will help you get where you need to go and get out, but we can only do that if we know where you are. So even though this seems like maybe a little extra step, it really isn't that much work to do, and it's important so that we can keep track of where you are. I don't know how to navigate back and forth without this doing everything. There we go. There we go.
Okay, so 2 other things I just want to mention quickly and go on to other stuff. Housing and safety is very hard because you don't know where you're going yet. I don't know where you're going yet, so I can't target it, but I'll just say this. We are going to ask you, we're going to require you to work with whoever you go, this is the Center for Global Health, with whoever you go overseas with, and write down a document or sign your name to a document that says you've discussed these various things. One of them has got to be housing, because we do a post-travel survey every year, and the one thing that keeps them coming up again and again is, I had trouble finding housing. So before you go, work with your mentor to get suggestions. Now, we have a very sort of protean list of places that students have stayed, which is not up on the website yet, but I'll see if we can get that up soon. It's really a work in progress, so it's not very many, but if we can add to it, there's lots of caveats, like not guaranteeing it's going to work, but if a student has been there and it's worked for them, it probably will work for you. So it's just suggestions, but definitely talk to your mentor overseas about that. Talk to them about safety issues. It's really, really important. Even if it means getting that orientation when you first get there, but you got to make sure you talk to somebody about how I can avoid getting into big trouble.
How many of you have applied to funding through the Center for Global Health? Okay, a lot of you. So you maybe have one foot in a department and one foot in Center for Global Health. Right. So these make sense. How many of the projects that you applied to listed costs beyond the funding for Center for Global Health? Some of them did, and that's something that Dick asked them to add this year, because right. to not have students get caught by surprise when you arrive, that there are additional expenses. So, projects may not have any ability to help you. They may. These are conversations to have before you leave, so that you're not caught unawares. So,
yeah, I think it's really important. We did that last year because we had a couple of students who applied to go somewhere, got selected to go, and then found out how much it cost. They didn't think about it. I think it's really, this is part of what Karen was saying. You really have to think about in advance what you're doing. This is on you. This is not for us to spoon feed you. You have to figure out what it's going to cost. So if you're going to go to Delhi, start saving your pennies like 5 years ago. It's different if you're going to the sticks in Ethiopia.
Yeah, I mean, there are, and organizations will have rules about where you can stay, and it has to do with safety. Every group that you travel with has to have a safety and evacuation plan if you're actually working with somebody at Hopkins. So the reason that they're having you stay in a certain place may be safety, and so the cost may be higher. Do you want to mention anything about visas here a little bit, or?
We could both tag team on visa. Visas are a really important issue. The only thing I would say is, as soon as you find out where you're going, try to get your visa. Best thing to do is go down to the embassy in Washington. Presumably there will be one, and get it there. Go look at their website, talk to them, but try to go in person to get those things because it makes it a lot easier. And the one thing that I would encourage you do, if you're a foreign student, if you're in other words, if you're not a U.S. citizen, you really should be going to your embassy to talk about how to get a visa to the country you're going to. And the other thing you should be doing is talking to what's the international office here?
Yeah,
about how to handle going away and coming
Coming
back
back.
to Hopkins. That's a really important issue.
So they can help you with some questions, but they will not get your visa for you.
Correct.
So there's not a service here that is going to help you and track down your visa. So that's also something to work on the timeline, because it may take some time. Even if you go down to the embassy, they may have things that they need to mail back to you. There are times that organizations require other things. I know of at least one case where they required a police background check and fingerprints. Well, some countries do need fingerprints. So we don't have a running list of that. That's why we're giving you the State Department travel site, and really we're just trying to give you the resources to start planning this. I would actually start a document and try to see what it is that you're checking off, and use the Global Health handbook as something that you can use. So even if you've traveled before, travel changes. So what were we looking at today, Christina? Who's on the State Department? Colombia's on. It was just added. They're adding countries and removing. Well, I remove countries very often, but adding countries that are on the warning list, and so that also has some other implications for travel in and travel out, and how long you can stay, and whether you need a work visa or whether you need a travel visa. We can't really answer that for you. Those are things you're going to have to work out by thinking in advance. And if you think about that a week before you go, you're going to be upset. It won't work.
The other thing that's important is you should try to establish with the person you're going to be working with, a faculty member, really how long you're going to stay, because that might have a bearing on the kind of visa you get, because you might be able to go over for 2 months, but if you go to the 3-month limit, it might require a different kind of visa, so you have to. How many of you do not have a passport? Okay. No, good.
Okay, there's a couple. So
I missed the hands.
Okay.
If you don't have one, you should really be doing it right now. Right now.
And you may want to go down to DC, because otherwise doing a rapid one is pretty expensive. So yeah, I talked to several students, and those of you who've traveled and most of the hands went up, no, you really need 6 months on your visa. I can't tell you, even colleagues of mine, that we get ready and go, we go, oh shit, I don't have 6 months on my visa. So on your passport, I'm sorry, you need 6 months on your passport. If you haven't looked at your passport in a while, take a look at that. If you traveled a couple years ago and you don't know how long you have, pay attention to that, because that's pretty important. I think those are the main things. I have just 2 more quick slides about, one about the international health travel forms, and Christina would shoot me if I didn't cover this. There are required forms that you have to fill out, because we don't have that travel registry really up and going that's electronic. We're looking forward to having that. It'll be something that you can change a little bit more flexibly, but right now there are some forms that are available on our SharePoint site. So when you log in to my.jhsph and go into our department, there are travel forms. And there's a checklist that you have to have signed by your advisor. But in addition, in our department, if you're traveling to a country that has a travel warning, you need to do that, fill out a travel warning form in advance, and that has to actually go to a steering committee in our department and be approved by Dr. Black before you can travel. And so we have students that go to Afghanistan. We have students that go to many countries that are on that list, Nepal, others. You need to have a travel, a specific approval to go to one of the countries on a travel warning site. And that also catches some people unaware. They're not really thinking about that. So keeping track of that, I know that, again, Christina keeps track of it pretty closely of, what countries are on there, and make sure that, we have the right information. Again, the answer is we have to have a reasonable understanding of how you're going to be getting out of there. So the organization or faculty have to have filed a safety plan. So we're checking to make sure that that's in place. So it's for your protection. The last sort of information thing before we get to discussing some cases, and that's why I want to spend our time on things that students or faculty have found in the field. There's a really great online training that was actually developed by the Berman Institute on ethical challenges. There's 10 pretty straightforward case studies of things that may arise that are really more ethical dilemmas. Some of the things we're going to talk about have that element as well. We want everyone to complete those before you travel. It's not very onerous, but they really are well thought out issues of ethical dilemmas that you may face when you're in the field. So this is more maybe than you completed when you traveled before. Then you can submit, you'll get certificates that you can talk to your program people about how you need to submit those, but we want to make sure that everybody's reviewed those. So, okay, that's, I think, the information piece, because we decided we didn't want to overload you with information. We wanted to try to make this a discussion. So we're going to move on to that, and we're going to have some time for questions and answers at the end, and can be available for that afterwards. But, okay, so we're going to have some questions. This is Hashem Shabbat. How many people know Swahili? Yeah, so, okay, so this means boil your brain, right? I mean, these are questions I really are going to make you think, we hope. They're really things that have happened, and we want you to think about how you would actually handle different situations that come up. So here's how we're going to run it. We're going to put some cases up. I'm going to bring Melinda and Luke up for them to facilitate these discussions. We have Jess, who is going to be here, who's going to be traveling Oprah with the microphone, because we're recording this. And we're going to put these up, and we want you to be sitting next to somebody, because we're going to ask you to talk to the person next to you and try to figure out how you would respond. So we expect the noise level will go up in the room, ask you to stop, and then we're going to have it facilitated by Luke and Melinda to discuss really what some things are that you can consider. So everybody ready? We have a timekeeper over there, so we make sure that we get on to all of them. So are you guys ready? I'm going to ask you to come on up here. So we need to have you, oh, actually, I do have one microphone that one of you can use, and one of you up here. I do. I'm on, right? Okay. You want to hold that one, or somebody has to stand, I guess, because, okay. All right, well, I will just, I'm going to turn it over to you guys. Do you want me to read off the cases? Okay. All right, well, here's the first one. We're going to give you a minute. I'm not going to talk. You're going to read it, turn to your partner, and talk about it. Ready? Okay, now, go. I don't hear anything. You're supposed to talk to each other. They'd like you to just call them and ask them to. Yeah. And actually, then Jess is going to, so you can call on people. Is that okay with you?
It's just,
I know they are. Well, that's why we have a student volunteer. Do you want me to actually have one on the other side, and that way, and then you two stand here, because you have to be at the mic. All right, I'll be over. I'm going to let you just.
so we're this one.
That's
Yeah, I'm sure you have a lot of that.
Who asked
They're signaling that the time is already up.
Okay.
Okay.
Oh, that was fast.
So I didn't realize you were going to get such a short amount of time. So hopefully your brain boiled and you came to the solution or a range of solutions. Okay. So let's hear it. What do you do in this situation?
So let's have a volunteer or two.
We have two microphones. You actually have to speak into the microphone because apparently they are recording the session. So please speak into the microphone.
Okay, now no one's going to talk. We'll actually hand it to someone if
Okay,
we.
yeah, we'll just.
I'm
I'll
happy
hand
to
it
do
someone.
that. And got it, volunteer?
Okay, so
like we were talking about it and we were like, we don't think we're confident in biostats that much to like disagree with someone.
Yeah, I know that feeling too.
Yeah, but we were just talking and Amelia was saying that, you would, maybe try to contact a professor back in the States or someone who's with you and kind of first confer with them and see if you're on track, and then maybe show proof instead of argument, that these are the steps I've taken and this is the different results I've had, and hopefully they'll want to engage in a conversation.
Okay.
Do we have anybody else that has a thought on how they might handle that? These things come up. Karen.
Well, depending if you're going to be working with these people for a while, I think you want to work with them on the decisions, find out why they disagreed with what you had, and then kind of come to some maybe mutual decision. If you can't do that, then you usually kind of go up the scale and work with their supervisors or their whoever your PI is, to try and work together. But as you see, it's a team, and I think we got to be a part of that team too.
Sure. I mean, I think both points were right on. This is, when you see things being done differently than maybe what you learned in biostats or epi, I think the first point is not you're wrong, but it's asking, why are they doing it that way? And there may be a very good reason, depending on the field site. And so I think, asking first, why is it being done that way? And if you're still not convinced or you have concerns, going to, your Hopkins or your person back home, if you're not doing a Hopkins project, and saying, I have some concerns about this. And that person may tell you this has been discussed at length and we decided to do it this way, or they may say, actually that's a really good point and we should think about it. But I think especially, for the master's students and internships, like the second commenter said, you want to be working with these people in a team. So you don't want to go in there right away and say, you're doing this incorrectly, I think.
I don't know, Luke, did anybody else have any comments or actually experience with having to be in a challenge like this? Because I know we have a lot of you raised your hand that you've traveled before, so I don't know if you were just on vacation, but okay.
One thing about sort of feeling confident, everyone here is getting a very good education and background, like in the principles of epi and biostats. And sometimes when you go out, after you've taken those courses, you may feel not very confident that you can actually apply them. But you'll be surprised, I think, how much you've picked up and how much you are able to apply those skill sets. But that I understand that feeling of not being sure. The other thing is that there's no really, for this type of issue, rarely there's only one right answer, and part of your training is about sort of adapting the solution or the skills that you have, adapting the types of approaches that you have to different situations. So you can always, remember that what you're really trying to do is adhere to principles as much as possible, but in every situation there's opportunities for you to have to adapt. Nothing's quite as black and white as the 2x2 table that you saw in one of your classes when you're out in the real world.
Okay.
Should we go to the next one?
Let's go to the next one.
Okay.
All right, we'll give you a minute to read it and then do the same. Talk to your neighbor.
Go boil your brain.
I was in my first year here in my master's when it happened, and Joanne and Jim came and talked, gave us all a very serious talk about it. So, and since I was then in Bangladesh, I actually heard the more detailed backstory of what happened.
person was in India?
I thought, or something at least happened that I heard about in Bangladesh.
Oh, insular. Yeah, no, this one is. That was also a very difficult case, but this one, at least the one I had in mind, I'm pretty sure it was someone who was doing like focus group discussion somewhere in India. Oh, okay. All right. The time is up. Any comments? What should you do? What's
Let's get some hands
what do
of
you think's
people.
appropriate, etc.?
There was a lot of good discussion, so I won't call on somebody if you raise your hands, but. Quiet. Silence. Okay.
I think we just decided that if you're not sure, don't. That's kind of the easiest question. Like, particularly if you're in this type of situation where you're privy to information that isn't necessarily general knowledge, and you can't control who's on the other end of reading it, just don't do it.
Okay.
We said that it would depend on the situation, and I think the best thing for the person to do would be to go to a supervisor and ask what is acceptable, especially in the case of a study where information can be sensitive in terms of location or environment or conditions. We feel like the best thing to do would be to go to your supervisor and ask what is appropriate for that setting. Yeah.
Room, anybody? Thoughts? Yes.
I think that it would be great if people went to their supervisor and asked these things. But I feel like Facebook is such an impulse, and people post things, pictures, things that they've seen, thinking, oh, this is really cool, I want to share it with people. My general advice would just be to say, talk about how you feel about something and not the details about like, I went to this discussion and it was awesome and I felt so inspired, or I felt so sad, or something, more about your own personal reflections rather than specifically what people said. Yeah, Facebook can actually like destroy your career as a researcher pretty early on. So I've seen it happen. So yeah, once it's on the internet, it can be anywhere. So
Yeah, it's searchable. So who you're friends with doesn't necessarily, if there's a term or something that's uncommon that you find in a group that you're working with, and somebody just searches that term, your Facebook will show up. So sometimes I think, and same with your blog, if you've not shared the blog with other people. So, Christina.
I was thinking, although I think it's good to go to your supervisor, of course, when you don't know, I think this is a pretty clear-cut, definite no. Anything about, there's confidentiality with focus groups, and you really shouldn't be posting anything about that on Facebook or any other social media site. I don't know that you necessarily need to go to a supervisor to ask that.
What would you post? How many of you had a blog when you traveled? Couple. What kind of things did you post? These are part of your normal life now.
I blogged when I was teaching a literacy through photography program in Tanzania. So I would blog sometimes about experiences that I had teaching, but it was definitely not in a research situation. And when we were discussing this question, I sort of skimmed it the first time and thought, oh, okay. But then I read it a second time, and I think a really important distinction is that these observations were during focus groups or interviews, and there is confidentiality, like you said, in that situation. And I think if you intend to blog about it, you should probably get permission from the participants beforehand.
I think all of those are good points. Most of you, I think, have emphasized this idea of the privacy, or the obligation that we're under to keep information private or confidential, and I think that's really important. That's certainly a big part of this. But I think even outside a situation where it's research, or maybe it's just an informal discussion you might be having with people there that you want to share, Another aspect of this is sort of respecting cultural differences, because we have had instances of people actually not just sharing their experiences sort of in a respectful way, wanting to share something that they learned that was interesting, but actually making fun of or being disrespectful of certain cultural characteristics that are observed, or perceptions that are expressed, etc. And then putting that out on the internet as well, which is, that's another extremely negative way to present yourself as an individual who's representing Johns Hopkins or any institution. So I think that's an important part of it as well, is being respectful.
Yeah, I mean, I think another aspect of it beyond sort of that you're working on a study is you're working with people generally locally, and there's hierarchy and there's protocol, and so sometimes people get into frustrating situations. And even in the U.S., I'm always surprised about what people will post about their employer sometimes on Facebook, and so you don't want to do that either on Facebook or on your blog. Get frustrated and post something that might be interpreted the wrong way, or might offend the people that you work with, because that then really hurts the team that you're working with and potentially their relationship with Hopkins or whoever. Yeah. Is that your picture? Is this yours? Is this yours?
I don't know where the picture came from.
Have there been problems with Facebook or blogs since that incident a couple of years ago?
I don't know if any. Okay, what do you guys think? Enough conversation. This is an easy one, straightforward. Let's hear some comments.
We need some of the people that
Okay,
laugh.
guys, stop. Quiet.
Maybe it's more controversial than I thought. Go ahead.
So we spoke about this, and we're trying to figure out if this was a trick question. But since the prompt sort of says that we need to go, I'm assuming there's some reason that we have to actually go to the market. So in this situation, I would actually get on the motorcycle. I'd make sure I had a helmet with me, considering injuries are a huge issue in developing countries. But that's sort of what we said we would do.
Okay. On the front here.
One thing you want to be very cautious of, though, with motorbikes in particular, is that a lot of health insurance plans that you have will not cover you if you have been on a motorbike. It's considered risky behavior. And so as necessary as it is to get around in a lot of places, you want to be very careful that by doing that, you're not violating things that could be very important to you. So just be very conscious of the health coverage you have when you're doing activities like this.
And it's only 500
Yeah.
I mean, look at that both ways, right? It's short, only on the motorbike short, or it's short, you can travel there by yourself, right?
Yeah, I was just going to say you can walk. It's only 500 meters.
Yeah. One of the reasons I actually put down 500 meters is because I think a lot of people are cognizant that they should wear a helmet, and almost all your organizations that you work with will have a policy that you have to have a helmet if you're on a motorcycle. And you may never be in that situation on a motorcycle anyway, but there are so many instances where it's so easy to say, well, the helmets, we can't find a helmet right now, or it's in the building, and we just have to go down there, it'll be fine. It's just, that happens so often. I've seen that 100 times, right? And we all know that we should be wearing helmets, etc. But for example, our research project in Nepal has a very strict policy that no one can get on a motorbike, driver or rider, without a helmet, and our rule is broken occasionally. And when it's broken, it's usually because of this kind of situation. Well, it's just a short distance, and it's a road we go down all the time. These are the types of responses. So you'd be surprised how often that happens.
I motorbike experiences or thoughts?
I have a general transportation insight, I guess. You know, I think when you're doing transport, it's like you can either take a risk or sometimes you face a risk. And with facing risks, it's more out of your control. You know, if this van you have to take that's full of 20 people, someone's coughing in the back, you don't know if they have TB, and then it's definitely within the realm of possibility. And, you know, it's crowded and there's no seatbelts, and then, the tires kind of messed up and they're holding the door together with wire. You know, I mean, these are just like real possibilities that people could encounter, and that sometimes you just have to make the choice and really pray and hope that nothing happens, you know. And it's this idea, I feel that this is taking a risk, but sometimes we face risks just so that we can get wherever we need to go.
Yeah, I think that's a really good point. Many times transportation associated risks you feel are out of your control, and many times they are. I think you're absolutely right. I also think that it's important to have your own policy that every time you're faced with sort of a transportation issue, that you think about how to mitigate it. Is there another option? At least ask yourself that. Is there another van to go on? Is there another type of bus company? Is there someone I should ask about, the appropriateness or the reliability or the safety record of certain bus companies versus others? I mean, there are things that you should always have a policy of trying to mitigate risk as much as possible. Don't get in the back of, sit in the back of an open-bedded pickup truck, right? That opportunity comes along a lot, and you should never do it. I can tell you from experience, I've been thrown out of the back of one of those that flipped over, right? So it's really important to have, to mitigate those opportunities as much as possible. It's really essential.
Not to put too fine a point on it, but there is actually something in reality that happened a year ago. There was a medical student from an unnamed university, not this one, who was on a program for a year overseas. He was coming back late from some gathering or whatever and couldn't get a cab. He wanted a cab. And he was offered a ride on a boda, which is motorcycle. Motorcycle driver had a helmet. He did not. They ran into the side of a car. The student got killed. So it's not, this is not just fantasy. This actually happened.
So not surprising, I'm going to talk to you in a little bit, but your number one risk for death is motor vehicle / road traffic accidents when you're going to be overseas.
Where's Adnan when we need him? Where's Adnan when we need him?
Okay. There's a comment at the back.
Oh, okay, yeah.
Hi, just wanted to add, safety for motorcycles, yes, helmet, yes, but also if you feel something wrong about the person, don't go. If you know the person, fine. If you don't know the person, even if you can really take care of yourself, don't go. So I would also add that to it.
Yeah, good point.
Just one thing, I know, like motorbikes, when you feel safe about it and, like you feel comfortable taking it, that it's okay, but also be cognizant of the road conditions. Like there are some, like when it's wet, like even if you don't have another mode of transportation, maybe you should just stay there until the condition gets better. Like wet roads, unsafe roads, I think that's also something that you have to be cognizant about.
Okay. Read this one, discuss.
Is this one of yours?
This is a real one.
Yeah.
I mean, all the ones I put up, real things I've seen.
I had something similar to this, although it was a fairly small amount of money.
many are there? And how much time do we have?
5 or... Oh, 7.
7, okay.
So we're supposed to go till, because you have like 5 or 10 minutes. You know, 5
Okay.
minutes. And we can do like 2 more if you want.
Okay. Okay. Well, of these 3, which one should we do?
I think this comes up a lot.
This one's a good one?
Yeah.
Okay. Okay, volunteers
Okay,
to
let's try-
respond.
Let's try
what
and
should
get
you
somebody
do?
back here who hasn't talked. Anybody? Maybe in the back there? Christina? Looks like. No? If you haven't spoken out, it's a friendly room. Let's just see what. I can call on somebody.
Maybe you can start.
I'm gonna. Anybody back here? Has anyone had this situation happen?
Okay. Again, when I was in Tanzania, I had a couple teachers that I worked with approach me, asking me to fund their, I think, like university education, basically, for a year or something. And sometimes it was people that I had worked closely with and even cared about. So I'll explain how I dealt with it. I'm not going necessarily implying that this is the best way, but usually, even if it maybe could have been a manageable expense, I explained that it wasn't. And there, it was interesting. The perception basically was that all Americans lived in houses like on that MTV show Cribs, because it was on TV all the time. So a lot of the time, requests like that grew out of a misunderstanding of where we were coming from. So I tried to correct that misunderstanding, and the problem is when maybe it is a manageable expense and you have to be dishonest if you're saying that it's not, but at least that sort of is a way to get out of it, because we discussed in our group that whether or not you give her the money, it's probably going to lead to a bad place. Because does she owe you money? Does she ask for more money if you give her the money? If you don't give her the money, then, you know. So there's not really a great way out of it.
Any other thoughts about this in the back? Yeah, good.
So the project that I've worked on for a couple of years in Haiti, I deal with the same things on a regular basis, and it's usually more, you know, I want to go to school here, or I want to study this, or I need a book for that. It's more that than like medical emergencies, like I need to go to surgery tomorrow. And because the project that we're doing is really community-based, the way that we've usually handled it is saying, okay, you know, obviously this person needs this thing, so how can the community come together and deal with it on their own? And you can facilitate that. And sometimes it requires like giving some sort of an investment to that group and saying, okay, you know, if you guys want to pull this off, here's how we can help you. And then before that transaction happens, how's it going to be paid back? How's it going to be paid forward? Whatever the arrangement is, but really try to keep it within the local people helping each other out, because they have their own, you know, community and sense of accountability that maybe doesn't quite translate when you're dealing with a foreigner.
Yeah, I mean, I think those are good comments. You know, this was something that a friend of mine, actually I'd been working with him for about 5 years, and this came up, and we actually went through this type of calculus that you commented on. You know, how do we sort of as a group, how do we think about this more broadly? Like when situations like this come up, can we put something in place now that can deal with these types of special situations? That's kind of how our group dealt with this particular issue. But it was a very small organization as well, so we were trying to look for something sort of grassroots for that. But, okay. Last one, I think it is. comment on this one.
Sure.
Okay. Let's hear some response. What do you guys think? Go ahead.
Okay, I guess Aaron and I were talking, and I think we both tend to end on, or err on the side of being a little bit more respectful towards the culture you're in. You know, naturally, there's a lot of us here that probably enjoy running, but especially if you're a woman by yourself and you're trying to go, you know, it's just one thing. It's one thing that annoys both of us when we travel and are in any place for any extended period of time is when you see those people who are just passing through, and you can always tell them they're in their like short, like their Bermuda shorts or their Hawaiian shirts. Like there's no real cultural sensitivity, and so we say, like, you know, if you want to go running, just make sure you take all the precautions and show a little cultural sensitivity.
Also, just like a quick note, I mean, people are not going to listen to you if you do not, you know, look like them or like try to like come from their perspective. If they see you as someone who wears those Bermuda shorts and top, and then you know, walk into your clinic and you're like, let's treat you guys, then they're not going to actually like, you know, pay attention, because all they can focus is on how disrespectful, I would think. I mean, I have 90% of my family's in like rural villages, and so whenever I go visit, my parents are like, you have to dress like this, and otherwise that's all they'll talk about. So
Okay. Yeah, I mean, I think from a professional standpoint, it's distracting if you're dressed in a way that makes the people you're working with uncomfortable. For this example, I also think, you know, it's fairly straightforward, and the comments that were made were right on. And it can be a safety issue for women if you're running and it's a setting where that's not expected, and particularly if you're wearing clothing that is not considered appropriate. You're already going to draw attention to yourself, but you're going to draw even more attention to yourself. So, you know, rely on your local team, ask them what they think is appropriate, and listen to them, because in general they have experience with this.
Okay, we can go to the other one now, I think.
We're going to just skip?
Yeah,
Is that what you're saying?
so
Okay,
we can go
we'll
to
go
the
to
health
Noreen.
discussion now.
Okay, I think we're going to,
So
what we
one of
have,
those they can look
we're
at
going to
later.
post these, and there's a couple other cases that we want you to read through and consider. And actually, when you get ready to go overseas, whoever your mentor is, whoever your faculty liaison is, we'd like you to sit down and go over these and talk about them, because there really aren't one answer. It depends on where you're going, and some of the other cases that we have, I think, are worth consideration. So we'll provide this to you. Okay, so our next, is that okay? Yeah? Okay, so we have Dr. Noreen Hines, who's going to talk to us about preparing for the health of your travel, and she is the director of the Travel and Tropical Medicine Center at the School of Medicine, and we're going to let her tell you what you need to do.
So, yeah. Yes, please. Well, hi, everyone. I have good news for you. I'm not going to tell anyone what to do. I'm not your mother, and I'm not your father, okay? So, actually, my whole purpose here today is to assist you in deciding what you need to go and do, other than the fact that I believe that you're required to seek some travel medicine assistance. It doesn't have to be here at Hopkins. So before I start, how many healthcare providers are in the room today? Okay. And I noticed from all of these comments that there are quite a few people who have lived and worked overseas. So how many of you have worked overseas for at least a year or more? Okay. So I'm going to, for almost half of you, it's going to be a review of things you probably did for living and working overseas. For the rest of you, this I hope to create for you a paradigm, because if you're going to go and work internationally in the future, my hope would be that you do this, and this becomes part of your preparations for living and working overseas. So, thanks. So, I just used prevent. You don't have to do them in this order, except I would suggest that P and T. P is first and T is last, and the rest you integrate over time, okay? I'm
Yes,
supposed
that's
to.
okay.
Oh,
Yeah.
okay. I
Okay.
have a big voice.
No, but they're
though.
actually.
Okay.
Yeah.
So just we'll go through this: prepare, risk assess, educate yourself, vaccines and other tools, evaluate your plan that you have, your needs assessment, not everyone else, and travel medicine visit, where to go and how to do it, etc. Okay, next. Okay, not a surprise, you need a plan, so you should be doing this now. In how many months will most of you be traveling?
3.
Okay, you have a very short timeline. Remember that timeline that Karen was talking about? You need to put this early on your timeline. So prepare, prepare, prepare. So who, you, and if you're traveling with someone else, you can actually do it together. What, okay, what is it that you need to do to prepare for staying healthy? When, right now, it has to start now because you don't have much time. Why? Because there's nothing worse, particularly for those of you who've lived and worked overseas, than getting sick while you're away, or severely sick, or having to be medically evacuated. All of these things I've experienced when I've lived overseas, including having to be medically evacuated, or actually brought people back on medical evacuation. And why healthy and how, that's what I hope this is going to help you to do. Now this little ring over here is all about, you know, some of you probably in some of your courses, if any of you do any health policy work, have learned about the risk analysis paradigm. You know, people tend to think this is overarching, it's all about policy out there in the big world, but it really can be reduced to the individual because you are doing a self-risk assessment to determine what you can tolerate, okay, what your risks are, where you're going, etc. Okay, risk communication is already going on here today, and there's also some risk management in this because the school tells you what you must do in order to stay healthy. So this risk assessment is going to be very important for all the rest. And so how are you going to inform your risk assessment? It's educating yourself. And so I would suggest that for those of you who haven't traveled before, you might want to try just Googling CDC Yellow Book for the country that you're planning to go to so that you inform yourself about what are the health risks in that country, what are the types of things that CDC recommends for you to do to protect yourself in terms of vaccines and other prevention strategies, antimalarials, etc. Okay, for those of you who have traveled extensively before, you might want to just go there for a review. Okay, but I think it's very important to find out as much as you can about the country and the risk factors that are going there, including talking to your mentor, other people in the school who have gone there before, who are going to the same site that you might be going to. Very informative, very informative.
And to make it a little bit easier, we've actually, some of the references that you provided, they got a handout.
Okay,
So we put
great.
some of those references for you and what the kinds of information that you can get on those. The Yellow Book is actually really comprehensive and a really good resource.
So vaccines, people always go, I know that you, some of you will get small travel grants, and we're going to get to that. Okay, vaccines can be very expensive. And because of that, please understand there are 3 types of vaccines. Routine, those are routine for the United States that would be recommended for any adult to receive, even if you were never leaving. Okay, I suggest that you see your health care provider to get those as soon as possible so you're up to date. Okay, things like tetanus shots. Okay, recommended are things that the CDC and or the World Health Organization recommend for people traveling to the country that you are going to, and it will be listed on CDC's website. Required, okay, there's only one required vaccine, and it's only required in some countries, and again, CDC's website can help you, and that's yellow fever vaccine that requires, for certain countries, a certificate of yellow fever vaccination. There are many other countries where it is recommended, okay, and so that doesn't mean that you're, because it's recommended versus required, if it's just recommended you can go without it because it's not a risk, honest, it is still a risk depending upon where you'll be in a country. Okay, and the only other requirement at times is, I don't think anyone here is going on a project that will take place during the Hajj in Saudi Arabia, is that right?
It may happen. People
Okay, if
travel throughout the
anyone's
year.
going to do a project in Saudi Arabia during the time of the Hajj, you also are required to have meningococcal vaccine, and it must be within the past 2 years. Okay, And then medications, pre-exposure for things like malaria, post-exposure, self-treatment for travelers' diarrhea, and other treatments. Look and see where you're going to inform yourself and to find out about the medications, because medications cost different amounts of money and may or may not be covered by your insurance policy. And then personal protections, clean water, safe food, insecticide-treated bed nets, insect repellents, and condoms. Condoms, yes, yeah, yes, okay? I hate to tell you, if you're going for 3 or 4 months, or even, and 6 months or a year, if you think you're going to stay celibate, that's fine, and many people in this room may, in fact, be celibate. But if you aren't, and if you think, if there's even a remote possibility that you're going to be sexually active, please take them with you, because in the country that you're going to, they might not be so hot, okay? So preventing, remember, STIs are everywhere, and the only thing that you're preventing is not just HIV, there are many other things. Yes, syphilis, gonorrhea, chlamydia, I could go on and on. Next. Okay, evaluate. Okay, everyone in this room, if I were to do a survey, every one of you has a different idea of what's ideal for you. So I can't come here and give you a one-size-fits-all, because it doesn't. You have to assess what would be ideal for you. If you had unlimited resources, what would you do? Would you get every vaccine known to mankind and do all of these other things? Okay, because you love vaccines and you want to have total. What's unacceptable for you? What is the absolute thing that you don't want to get or be sick with? Know this, okay, ahead of time. And then you do the needs assessment, okay? Then, okay, to meet my needs, what are the vaccines I need? How much are they going to cost, okay? And what's the cost going to be in money? What's it going to be in time? Where am I going to have to go? What research do I have to do? Do I have to, like, take a break, go home to wherever my home is, maybe see my doctor there? Do I have to go to student health? Will student health even provide them to me? You have to do a lot of background, because running up a week before you're leaving is actually, in some ways, too late. Next. So the last thing on your list is, of course, you need to be prepared for a travel medicine visit. Now, you might want to get your visit scheduled, and then do all of your research, okay? Ideally, it's 2 to 3 months before you leave. Oops, that's just about now, right? Visits and vaccines are not covered for travel medicine visits anywhere, okay? Unless you work for the Catholic Relief Services, which has their headquarters here in Baltimore, or World Relief, which also has its headquarters here in Baltimore, no insurance covers travel vaccines, okay? So it's cash at time of visit. So you need to know that, and you need to figure it into your plan. You know how much your airline flight's going to cost? Well, this is going to cost too. Get your routine vaccines before you ever go for your travel medicine visit. You know, this is also on the CDC website. What are routine adult vaccines? Find out and see if you're up to date. Get your immunization records, because you'll be asked for them no matter which travel clinic you go to. Decide how much money you have available to spend for this part of your preparations to go overseas before you go. Because it's horrible to sit there and go, oh my God, I really want those 6 vaccines, but it's going to cost me, with this visit, $1,000, for example. If that's true, do you have $1,000? Okay, medications are usually covered by your insurance. That's the good news. But find out how much will be covered. Some insurance policies only cover 30 days worth of an antimalarial, for example, like atovaquone proguanil. Used to be Malarone, but now it's generic, so it's cheaper. Okay, just a month and a half ago. Find out if your department and your mentor or whoever you're working with is going to cover all or some of this. Okay, sometimes it happens because they remember to put it on their grant. And most of the times it doesn't. It falls on you. Decide where you want to go. Do you have to come to Johns Hopkins? No, I'm going to be quite frank. We're the most expensive travel medicine in the Baltimore, Washington area, okay? We are. We are also the best, Okay. And we've been around for 25 years, okay? We're so expensive because we're part of a university structure, and everything that we bring in, 25% goes to the dean's office, okay? So that's not here in the School of Medicine, okay? So we have two sets of taxes, the dean's tax and the departmental tax, and it's 25%. So we have a 25% markup on everything we do so that we can stay open. And just so that you know, I want to make clear, it's a very, very, we're not making a profit. Dick will know, we're not making a profit. So you don't have to go here, call around, call the Passport Health, call Union Memorial Hospital. The convenience for us is we're just across the street in the Johns Hopkins Outpatient Center. So you need at least 2 weeks, at least, for vaccines. Like the most common vaccines that people get who travel are hepatitis A, typhoid vaccine, and yellow fever vaccine. You need at least 2 weeks to have immunity beforehand. You need 10 days before you travel for your yellow fever certificate to be valid. Okay? And you often need it to get a visa for certain countries. So that's it.
That's it. Okay. We have a few minutes, and I think it would be good to open it up to general questions, if anyone has this. I appreciate your taking the time. I really think we had some good discussion and hope that you'll take some of this back and talk with your academic advisors and your individuals you'll be traveling with. Are there any pressing questions? Now you know from Noreen that we don't have the answers, right, Noreen? You're gonna have to search them yourself. But the information sheet that we provided to you has many of the key sites that you can begin your search. And even if you don't know what country you're going to, there's commonalities across countries that you should be thinking about for preparation. Okay. Anything else, Christina? Okay. Well, thank you.